I want to start off by just saying you're all really nuts. Have you seen the weather out there? Having said that, I want to thank you all for coming out and participating. It's really a time that we cannot afford to stop, lose, or give up hope. And that's why tonight, us as a medium-sized grouping of progressive activists, taking advantage of this Fat Tuesday, the day before Lent begins, to march down the street and to confront what the insurance companies or the banks or the union busters are all going to be using as their front group as they try to block reform and funneling their money after Citizens United. And we're going to show the public's anger that's really out there. But at the same time, we're going to do it having a good time and showing people that we have the ability to laugh. Because we want to not only be able to represent the anger that they feel towards the injustices going on now, but we want to give them the hope that change can happen and that doing it along the way we can have fun. Let's go out there, freeze our butts off, and take it to CBIA. Thank you very much.
Of the offices of CBIA, an organization that carries the water for big business and big health insurance here in Connecticut. CBIA symbolizes what we're up against in the fight for quality, affordable health care.
Wait a minute here. CBIA is not the enemy. We're not the bad guy here. Innocent people and businesses from the health care that the government is going to run. Corporations don't want to invest for our country. Look at the latest ruling from the Supreme Court. Didn't they back us up?
Listen, fat cat, do you understand what the name of your company is, your organization? It's corporations before individuals always.
Yeah, that's right.
And we're not going to stand for that here in Connecticut. CBIA belongs to the U.S. Chamber of Commerce that spent record amounts lobbying against health care reform. You don't care about the little guy. You only care about your bottom line. Did you see the national report that came out last week? It said that health care reform would actually create 4 million jobs nationwide. 4 million jobs if we created health care reform. That's right. No, you're stopping us from having those 4 million jobs, Mr. Fat Cat. You're so busy protecting Aetna, Anthem, United Healthcare, and all your fellow fat cat insurers that you lost sight is really good for business and the people of the state.
Calm down. You are getting your facts all wrong. If CBIA did not protect the insurers, who would? We are so misunderstood and unappreciated by the general public.
You know why you're so unappreciated? We'll tell you why right now. Let's ask the crowd to list some of the ways health insurance companies let them down every day. How about it? Anybody in the crowd have any examples? Yes, ma'am.
How about the person who raised my premiums 43% this year? Explain that when you're breaking in corporate profits, mister.
And they won't cover my cancer treatment because they claim that I have a pre-existing condition.
And they turned down my claim for Lyme disease because they said it was experimental.
They raised my small business's premiums 35% because 2 employees turned 50. That's not fair!
What do you have to say for yourself?
Wait a minute. Those are just a few exceptions in this crowd. How many of you have insurance and are happy with what you're paying? Raise your hand.
I'm happy. I'm happy with my
I know you should be.
Thanks. I work in one of those big buildings up there.
Yeah.
1,000 employees. I'm happy with my health insurance. I have low co-pays. It doesn't cost me too much. It's good
country. What's the matter? When my health care is good and hers isn't good, for what reason? Only because of where we work? There's something wrong here. Any economist, I'm not an economist, but anybody can tell there's something wrong with the way this insurance works in this country. What do you have to say about that?
Clearly misguided. You didn't have the advantage of reading the CBIA health insurance manual. Caring for the bottom line first. Caring for the people that are ill if we can afford it.
Do you like what you're hearing? No! Mr. Fatcat, I suggest you go back to your boardroom and tell them that American people want quality, affordable health care that we can count on.
Yeah. But I assure you that can't be done. We can't be done under the current business model. We need to deny care so we can pad our profits. It's the only way.
You heard it here, folks. It's time we got the job done right in D.C.
Connecticut's congressional delegation -1 has been great on this issue.
Great.
They are ready to stand up for quality, affordable health care. Our message to Dodd, Larson, Courtney, DeLoa, Himes, and Murphy.